We know Chicago is bracing for a surge in cases, much like what we're seeing in New York. But many doctors here say they are already seeing a strain on our hospitals.
CBS News David Begnaud spoke to an ER doctor from Mount Sinai on the front lines of the violence in Chicago every day, now fighting this new battle.
This is the most scared I've ever been being an ER doctor. And it's not just because of me. It's because I have a wife and a 2-year-old and a 1-year-old at home. I don't want to expose them. People say it's our job. It's not our job, it's our duty, and it's what we signed up for. I deal with gunshots every day and trauma and crazy stuff, and this is the only thing that scares me.
How many patients do you see on a daily basis that are suspected of being COVID positive?
Over 60 to 70% every day.
We keep hearing that young people are not as affected by this. Has that been your experience?
You can tell that the 27-year-old I intubated last week who had no medical problems.
Dr. Samlin says anyone arriving at the emergency room now who has respiratory problems is being treated as if they're positive for COVID, because doctors can't afford to wait the 3 days that it's been taking to get the results back.
Well, we're having another COVID come in. Do you want to see the setup before it comes in?
Please, please.
So before we go in, we put on gowns, we put on goggles, we put on as much PPE as we had. Respirators, we could have them to intubate the patient, or put a tube down the throat.
This COVID patient who's coming in right now, the suspected COVID, he's coming by ambulance, I assume. How critical is he?
They're doing CPR on him.
Wow. Intrepid work as usual. David joining us live. At first glance of that story, the question is, how's the patient? And we now know they died, correct?
We do, Brad. In fact, before the interview concluded, I asked Dr. Samlin, do you have an update? And he stood up again, and within less than 10 minutes arriving at the hospital, the man had died. And they treated the case as a COVID positive because, Brad, they don't have the 3 to 5 days to wait to confirm that someone is. So when they heard it was a cardiac arrest coming in, they activated their COVID protocol.
So, David, it's shocking to hear from an ER doctor who's been through Ebola, SARS, gunshot violence here in Chicago, saying that he is scared. But what surprised you most about what he said in this extended interview?
Irika, I was surprised that he even answered the phone in the emergency room. I thought, do we need to call you back? And he said, no, let's do it here. I was surprised at the candor, the vulnerability, the emotion, and the fact how he kept saying, I'm not just worried about what we're dealing with here, I'm worried about taking it home, because usually I could leave the trauma at the hospital. But he said it's traumatic to go home and figure out that I clean myself enough to where I'm prepared to walk in my house, hug my wife, and kiss my babies.
There's a rawness what we don't typically see. Now, David, you have seen New York firsthand, other hot spots. Hearing what they're desperately asking for on the ground here, is Chicago prepared for a surge, or are we going to see a triage center at Millennium Park like we're seeing in Central Park? Are we ready?
So here's the thing, Brad. I think it's unfair to look at what's happening at Mount Sinai and say that is reflective of what's happening in Chicago. Your leaders, just like New York's leaders, New Orleans and Florida, say they are doing what they can. But here's the bottom line. It was essential that we hear from him, because we keep hearing there's a need, but not a lot of doctors feel comfortable talking. Some feel like they're going to be fired, and some have been threatened to be fired if they talk to the media. You know why this doctor talked to us? Because he put a GoFundMe page online because they didn't have enough masks for their people, and there was an outpouring of support. That's how we found out about him. We reached out to him, and he was more than happy to talk. They are overwhelmed with the COVID patients. The ICU was full of them, and they were housing people in the ER, isolating them in rooms that aren't even for isolation.
David, so you've talked to the doctors there at Mount Sinai, doctors and nurses from all across the country. What's the one message you keep hearing from them?
We need equipment. There seems to be a disconnect, Irika, right? So we'll hear from the White House, we'll hear from FEMA. that they have enough supplies. But the bottom line is you keep hearing from the guys on the ground and they're raising their own money. I mean, one doctor in the piece was wearing a respirator. He got the filters from his dad who works in construction and the respirator mask from a previous job he used to work at. That's what they're dealing with in Chicago, but it's not just Chicago. It's everywhere around the country. So what I continue to hear, talking to doctors every day, is we still need supplies. But I do love at the end of that story where he said, we also need somebody just to say thanks, because you don't know how much that means after an 18-hour day when you walk out of here. Just a simple thank you.
CBS News' David Begnaud, one of our best. We appreciate your time tonight.
Yes. Thank you, David.